Good morning. Good morning. You're welcome to our today's lecture on the course Basic Dispensing Theory 1, BDT 152. Right? Okay. Thank you. All right. The topic is suppositories and pessaries. These are our first contacts on this topic. Okay, you are familiar with the word suppositories, pessaries. I can remember in our first semester we mentioned suppositories and what? Pessaries as types of what? One of the types of what? Unit what? Solid what? Dosage forms, okay? And I told you clearly that suppository, pessary is also a type of suppository. Suppository is general because we have this suppository we use in different parts of the what? The body. So pessary is suppository used where in the what? Vagina. So we have the one used where at the rectum. In fact, these days, whenever you mention the word suppository, what comes to our mind is rectal suppository. That's what comes to our mind. Anytime that the word suppository is mentioned, what comes to mind is what? Rectal suppository. But actually, vaginal suppository, which is pessary, is also a type of what? Suppository. So, now, let's go over to definition. You have the course material, right? Yes. Good. Let's go over to what? Definition. Suppository is a medicated what? Solid dosage form that is generally intended to be used where? In the rectum, vagina, and to a lesser extent where? At the what? Urethra. Okay? So, as you can see now, we have the one used in the where? Rectum, the one used where? Vagina, the one you use where? Urethra. You know what urethra is, right? What is urethra? Huh? Is that what? What is urethra? Is what? You don't know? Tell me now. Huh? Organ found. Part of what? Is a papa? What is urethra? Okay, what is the major function of urethra? For urinating. Okay. From the urinary bladder, urethra is a duct anyway through which the what? Urine passes, okay? Through which what? The urine passes to the external outside human body. For male, if you see the penis, that tiny hole there, that's urethral opening. Penile opening anyway, but it continues inside as what? Urethra. But for female, that thing you see in male goes inside and attached to where? Empties into the what? Into the what? The what? Urinary what? Bladder. Are we together? Good. So when of course, you know that urethra and urethra are not the same thing. Hope you know. Urethra connects the kidney. Urethra, there are two. Each of the kidneys has its own what? Urethra. Urethra connects the kidneys to where? Urinary what? Bladder. After ultrafiltration, whatever comes out enters the urinary bladder through the where? Urethra. Urethra. That one is what? Urethra. You see sometimes if you see the diagram of You see something like this. It connects, right?
Yes, sir. Yes.
The other brother is somewhere here, right? You see the connection, two of us. Then outside, this one empties. This one that comes out from the bladder is what? Urethra. But this one is what?
Urethra.
So this is the urethra we are talking about. There are some drugs that are formulated for urethra, for as urethra what? Suppositories, okay? That's the point I'm trying to make here. We are not in physiology lab class, but I just let me just say one or two things, okay? Okay, so there's something I want us to note here. That after insertion of suppositories to these body cavities, what happens is that the suppository tend to do what? At the body temperature, it melts, okay? It softens at where? Body temperature. That one is not for vagina. Vaginal suppository, what happens that vaginal suppository mixed with, there's this, most vaginal suppository, they come as what? Tablet, hope you know. Yes. Insert, hope you know. Yes. So, they don't melt. They don't melt. In the presence of what? Mucosa, the fluid there, they mix and do what? Disintegrate. Know the differences. Urethral suppository, they will do what? They will melt at the body what? Temperature, and some of the other suppository, because of the type of base they use in the formulation, in their formulation. But that for vaginal suppository interact with what? The fluid in the what? The vaginal fluid, and what it does is that it disintegrates to release the what? Active what? Ingredient. So after the insertion, the suppository melts at the body what? Temperature. While the vaginal suppository, sometimes called what? Pessaries, they are made as what? Tablet, hope you know. So what happens is that they disintegrate in the what? Body what? Fluid. So that's what pessaries do. This can serve as a wonderful OBJ question. That the pessaries melt at the body temperature. True of us. She said true. So just know this point, okay? Alright, so now this is just general definition. Let's look at BP definition. How does BP define this suppository? So let's look at the BP definition of suppository. Suppositories, please silence your phones, please. Suppositories are solid, single dose preparation. Of course, you know that one, right? They are single dose. Hope you know. You know the difference between simple dose and multi-dose, right? Single dose and multi-dose. Yes. Just use it once, ever. So it's a solid single dose preparation. The shape, volume, and consistency of suppositories are suitable for what? Rectal. Please silence your phone. I say that according to BP, suppositories are solid, single dose preparations. They are solid single dose what? Preparation. And the shape, the volume, and consistency of what? Suppository are suitable for what? Rectal what? Administration. Have you not seen that? This suppository is not limited to what? As if limited to what? Rectal what? Suppository. But actually, by the term suppository, it is general. We have up to 5 different types of suppository, 5 of them. We have rectal, urethra. Anyway, we'll go into that. Right. Now, vagina, right? What else? Ear, right? Good. What? Say it. Nasal. Okay. What else? No, don't worry, we'll go into that. Now, according to BP, pessaries are single dose what? Preparation that have various shapes, usually what? Ovoid, with the volume and consistency suitable for what? Insertion into what? The vagina. The volume and what? Consistency is suitable for what? Vaginal what? Insertion. So they will shape it to be able to do what? Be inserted into where? The what? Vagina. Then another thing I want us to know here is that it may contain what? Listen carefully. These things may contain what? One or more active what? It mustn't be only one active ingredient. It may contain one or more what? Active what? Ingredients or substances that are what? Dissolved or dispersed in a stable what? Basis. Dissolved or what? Dispersed in a stable what? Basis. So you can have the active ingredient maybe what? Dissolved or dispersed in stable what? Basis. So when the active ingredient is dissolved or dispersed, of course you know what it means, right? Then at the same time, what happens is that this formulation may either be dispersed or dissolved in the body what? Fluid. I say two things now. The active ingredient may be dispersed or dissolved in what? Suitable what? Base. I told you something about bases, right? In the first semester. The difference between base and what? Vehicle, okay? I told you that vehicle, base, if you can close your eyes and say, okay, base and vehicle, but not really. But vehicle is more when you talk of what? Liquid what? Preparation, okay? But in solid preparation like this ointment, suppository, you talk of what? Base. Is one that has that determine the consistency of the what? Formulation. If the base is oily, there is high tendency, it's not that there's high tendency, that particular preparation will be what? Oily. If the base is aqueous, then that particular suppository will be what? Somehow aqueous in the sense that it will be what? Hydrophilic. You know what I mean by hydrophilic? And hydrophobic, right? Good. So if oil or fat is hydrophobic and the oil or fat forms a base for a particular what? Suppository, that means that suppository will not dissolve. True of us, it will be more of what? Melting. It will melt. Because that fatty base has come what? Solid. At temperature that is about room temperature, it will do what? Melt. True of us? Good. So that's the difference. But because most others, some of the base used for what? For pessaries are mainly glycogelatin based. They are water what? Soluble. Glycogelatin, they are water, they are hydrophilic. So that's why there is a tendency for pessary to be what? To do what? Dissolve when come in contact with what? They disintegrate. When they come in contact with the what? The vaginal what? Fluid. Because of the nature of the what? The base. Are we together?
Yes.
Now, so I said here that these may contain what? One or more what? Active what? Ingredient. Dispersed or dissolved in suitable what? Bases. Then the entire product may do what? Be soluble or dispersible or even melt at the what? Body temperature. So when you hear melt, you know the type of base that's involved, right? And when you hear dissolve or disperse, you know the type of base that is what? Involved. True of us. Now, apart from the active ingredient and the base, we have other excipients maybe what? Available. You can have excipients like diluents, adsorbents, surface active agents, lubricants, antimicrobial preservatives, very important in some formulations, and even coloring agents. Of course, now this coloring agent must be what? Approved by the what? Competent what? Authority, right? Remember our FD what? FDC, right? And FDC. Remember those? But that one is if what? Necessary. Now, what type of active ingredients can we now find inside these pessaries or even suppository? What is that what type of active ingredient can we find there? What it means that what drugs can we formulate as this suppository or what pastries? You may see something like some antiseptics may be formulated as that, okay? You see even some contraceptive agents may also be what formulated, even local anesthetics. She asked me what is contraceptive. Who tell us what are contraceptives? Tell us fast.
They are drugs used to prevent pregnancy.
So, are we together?
Yes.
So we also have some agents that are used to treat infections like bacteria. Some antibacterial can also be formulated as suppository or pastries. Even monilial infection, trichomonal infection, many anti-infectives can be formulated as pastries and especially pastries for this toilet infection. Some antifungals are also formulated as that. There are some combinations you will see antibacterial, antifungal, and the one that restore normal bacterial flora in the vagina. There's I've forgotten it seems Clovinal. I think I like that drug. It contains. Have you seen it before? Clovinal. Yes.
Is this
Sweet.
Yes, sweet and suppositories.
What did you say? What are you sweet? Oh yes, when I class. Do you? Is suppository oral or oral preparation?
Do you know?
So why ask whether it's sweet?
This one that you have done is
No. It's effective. That's what I mean.
Okay.
When it came out new, I was among those that promoted the product. It's very effective. For some of, even though this is not pharmacological, but at least it's good to say one or two things. There are some people, some of you, I think I mentioned this in one of my classes, that will go and keep taking antibiotic until it starts affecting their normal flora. Am I complete? Normal flora in the vagina. And then they start having supra infection, like infection will come, and they said they have infection. So maybe it's antibiotic. Any small thing they can use ampiclos. Any small thing they will use when needed and when. Some even go and buy the one they rubbing them when needed and when not needed. Also has some of these products that restore normal bacterial flora. You see that when a patient uses a product like that, it's fighting bacteria, fighting fungal infection. At the same time, restore the normal flora. Especially chlamydia infection. So it's a very good. So it's a pastry. It's a pastry. Many of them. You also have your clotimas or pastry, right? Yes. There's suppositories. You have your ducolas, which is a bisacoli, right? Yes. For what? To treat what? Constipation. Good. There are many of them. They are also the one used for treatment of bile. We have the anosol, right? Anosol comes as what? Suppository. You eat it. Yes, that comes as what? Suppository. So, now do that. So, these are examples of drugs that can be formulated as suppositories and what? Pastries. Suppositories and what? Pastries. Okay, so now, let's look at advantages. Let's look at advantages of suppositories. Remember what I remember. Remember, I keep mentioning this. Remember, when you talk of advantage, remember what comes to mind. Remember that we are not talking about no dosage form has it all. Remember, it's where that dosage form does well or better than the other. makes it its own what advantage, and where you should use it. But where you cannot, situation where you cannot use it, then it becomes limitation. It becomes limitation for the what, for the what dosage form. Okay, now let's look at advantages. Let's assume now that somebody, probably you cannot inject, or maybe you cannot inject. Then maybe you look for this thing, you don't get to inject, or maybe you know due to one or the other that you cannot inject the patient, and the patient cannot even swallow tablet. You know that there are some you may even of injecting them, because you're trying to inject them, you may because they cannot even stay one place due to one reason or the other. Am I correct? You may be even scared of what? Even the needle breaking. True of us. Good. Or because of the way they struggle, you may mistakenly, just to avoid all those things. You see that once the patient comes, especially children, you just insert the what? This suppository. So there are many other reasons why the oral route may not be what useful for a particular what medication. Irrespective of the reason, once the oral route is not useful, it's also an edge suppository will have in such what patients. Now there are also some situations whereby there are patients with what GIT what problems. Okay. GIT what problems. It can be that they are not nauseous, and also because of the fact that maybe after operation, we call it post-operative issues. Maybe after operation, they cannot be able to do what? Swallow and be taking oral medication. Am I completing? In such a situation now, you see that you may resort, if the product has suppository. If the drug is formulated as suppository, you may resort to what? Using what? Suppository for such what? Patients. So this is also an advantage. Now, there are also situations whereby the patient is very, very young. I think I mentioned that in a way. Very, very what? Young. Or very, very what? Old. Am I completing? Then there are some that are what? They have mental issues. Psychiatric what? Patients. You can use what? Suppository for them. Those ones. The people that are mentally disturbed, that can't even don't know what is come and take your drug. True of course. You can't even hold them. You can't even hold them to think of giving them injection. But if you hold them, you can just hold them. You can put it in their bump in their anus. Am I completing? Yes. So such patients, very young patients, very old, and what? Mentally disturbed what? Patients. You can use suppository for them. Then there are some drugs that may have some GIT effects, side effect that is not what? Tolerable. Am I completing? Yes. For a patient that seriously have issues with ulcer, that patient is chronically, that one is, he can't even, but he needs diclofenac. What are you going to do? You can give us what? Suppository. Are we together? You can give what? Suppository. Diclofenac is not the only drug that will have GIT issues, GIT effect. There are many of them. You can look for the what? The suppository and do what? Administer. Are we together?
Yes, sir.
Are we together? Okay. Now, there are some drugs that are not stable in the GIT pH, right? Remember, in the GI pH, they are not what? Stable. Apart from the what is it called? What actually happens? What actually happens to some drugs in the GI? Remind me what happens to some drug in the GIT that will make us not to try to bypass GIT. Especially the stomach. Tell me. Adoya. What makes it? What will help? What will make it to? What will make it to degrade?
It causes
The right word is degrade. What will make the drug to degrade in the stomach? What will cause the degradation? That is pH now. What else? What other possible cause? Enzymatic activities, yes. Good. Enzymatic activity can. So if you want to bypass, so if you want because of that GI issue, the effect of the what, the GI what pH and the what, and enzyme are there. So you have to what, use the what, suppository for the what of the drug. So you don't. Am I do in some situations you can still use injection, okay? But if you have suppository will be good, okay? You know, injection is good, but it will not be the first thing to do. Are you aware? Injection is not thing to do. If you have a drug that you can have as what, why jump into injection? And the patient can swallow the tablet. Why jumping into injection? We get for oral injections. That one, if the drug is not available as well, oral injection. Secondly, the patient cannot watch, swallow, or is unconscious, or you need to act what very, very to save the patient. That is, patient is normal. Just walk into the by him or herself is okay. Nothing is wrong with him. To the extent and hospital, it doesn't really make sense. Are we together? It doesn't really make sense. Okay, so let's continue. Remember what I said about first pass what? Metabolism. Adaki. Fast, come in. Fast. It seems I'll stop giving you materials. If I give you material ahead of time, is for you to study. But because I know that some of you will just come to that and play, because they know they have the material. That is not good. Since I'll stop giving you material after teaching, go and make your notes out. You see that you'll be serious with what's going on in class. Trust. You'll be serious. You should be jotting down to not playing. That's very wrong. And you're here laughing, playing. So what business has to let you be going? That's wrong. Leave my class fast. Leave. That's wrong. Very wrong of you. Leave. We just draw first password. First. Have you done it already? No. You still do it in your work. Have you done it? Yeah. Good. So where does it take place? Hey? You say first part, where does it take place? Where? Leave Abiko. Or since when the first time? It's liver now. It's liver. So now, in fact, enter that enters the mouth. Enter that enters the mouth, enter the stomach, digest, must pass through the what? Liver. Am I completing? So for such drug, to avoid them getting to liver and start having issues, they can be formulated as what? Suppository. Once you insert it, if you follow the mesenteric what? Vessels and enter the systemic circulation and go to site of action and perform their work, okay? Without having issue with what? Liver. Are we together? So it's also an advantage. True of us is an advantage. Okay. Now, of course, for patients that cannot tolerate test of some what? Drugs. True of us. Yes. To avoid non-compliance, so what you have to do what? You can use what? Suppository. Am I communicating for such what? Formulation. It's also what? An edge. Then there are some drugs that may be abused, as in suicide. You know there are some drugs that can be abused. Maybe the person wants to commit suicide, just go and take it, boom, and go their way. So such drugs, if formulated as what? Suppository. Even though those that say what to take it will still take it. But at least to some extent, am I completing? Yes. To some extent it will limit that, because to you know that this thing cannot be swallowed. Two of us, it should be used here in the anus. Your mind will not even go there to start looking for trying to swallow it. Am I completing this? And it's even big, sir. How will you swallow it? Are you with me? Unless you have decided to die. As if you are already the person that made up his own mind that I want to die. Yes, you can go and start. But how will you even do it? Break it and swallow it, drink it. How will you even do it? It's what? Stressful. But if it's in form of tablet, you can easily do what? And go your way. So that's some of the advantages of what? Remember what I said. Having suppositories as what? Dosage what? Form. The edge it has over what? Other what? Dosage form. Over what? Other what? Dosage what? Form. Now, what are the disadvantages of suppositories? That is some limitations, situations, conditions. Some drugs that cannot be formulated as what? Suppositories. Some conditions of patient that they already made the patient not to use suppository. Then some drug that cannot be formulated as what? Suppository. That makes us what? The limitations of what? Suppository. So the edge others have over what? Suppository also contribute to the what? The disadvantages of what? Suppository. So let's look at it. Mucosal irritation. You know, there's the tendency for the rectal mucosa to be irritated. Am I communicating? You know that the mucosa is easily irritated. Mucosa surfaces are easily irritated. So in the event of mucosa irritation, you do what? Avoid it. Use of what? Suppository for a particular patient or for a particular drug that may have such effect. Are we together? Yes, sir. Then traditional issues. You know what is aversion? You know that there are some traditions that you have that prohibit anything that has to do with inserting. You know, there's people who have different traditions. That a woman should not do what? Insert, or it's not. You should not insert anything through the what? Anus. It becomes their own what? Tradition, and you cannot do anything about it. True of us. You cannot do anything about it. So in such situation, there are people you will tell, please, we don't do this in our place. It becomes a what? What they are going to do. You say you respect that. So such people cannot use what? Suppository. And depending on how it is formulated, who do we have here? How are you? Welcome. You have been nice, eh? Alright, so depending on how is formulated, maybe if there's always, of course, there's always, anyway, not in all situations, but in one or two situations you may have issues with what formulation, okay? That's maybe because of the nature of the base used. This suppository may have what? Leakage. Am I communicating? So if there is tendency for what? Leakage, it should be under what? Dosage form should be what? Used, not what? suppository. Okay? Then another thing is that sometimes there may be what? There may be what? Incomplete what? Absorption. You may see someone after inserting, on this issue of leakage, after inserting suppository, you see oil coming out. Because of what? Leakage. Am I communicating? And that's coming out with what? The active what? Remember the active agent is not just, they didn't just drop it there. It was uniformly what? Mixed. So that oil coming out contains what? Active what? Ingredient. So it's not an issue. The patient will not get the complete what? The complete what? Dose. Now, sometimes there may be incomplete what? Absorption. Incomplete absorption may do what? Take place. Incomplete absorption may do what? Take place. There may be what? Inter and what? Intra what? Subject what? Variation. Now, when the effects of suppository, sometimes there may be, because of the nature of the dosage form, the effects it may have in you now may not even be the same effect again. And now what? Time. Am I communicating? It may also differ from one person to what? Another. Am I communicating? Now, even though it's unit solid dosage form, but you can't compare it with oral medication. Am I communicating? You cannot compare it with what? Oral. There are different factors that may lead to what? Differences in the effect. Am I communicating? There may be some different factors that may do what? Contribute to it. Sometimes there may even be physics. Physics there. I will have issues. Am I communicating? By the time we go down, I think it's also part of the what? Disadvantages too. True of course. It's also part of what? Disadvantages. Now, proctitis. What is proctitis? Who looked it up? You've read this? Yes. Who looked up the meaning of proctitis? Proctitis. Proctitis. Who looked it up? Inflammation of the what? Rectum. Rectal mucosa, okay? If you say rectum, is rectal what? True of us. Rectal what? Now, when there is inflammation, what do you think will happen? There will be issue using what? Suppository. True of us. In fact, that's sometimes irritating. Once the mucosal surface is irritated, there's cascade of reaction that will take place. A lot of things will come out, thinking that the system will think that there's something else that is trying to do what? There's a foreign body trying to do what? So there are a lot of reaction leading to inflammation will take place. By the time you do inflammation in your time, before the inflammation takes place, there's cascade of reaction in the body that will take place before inflammation will do what? Take place. So now, if there is already if there is proctitis already, using suppository will be an issue. Am I communicating? It will be an issue. There will pay. True of us. In fact, the patient will not even comply. If you're a patient, you get the position to put it. It will go. True of us. True of us. You do what? Throw it away and go your way. So there will be what? Non-compliant. Even if the patient is a baby and you are trying to insert, you cry out to squeeze your eyeball. Are we together? So, yes, even though extemporaneous compounding may not be that costly, but large-scale production is costly. So it is a limitation. True of us. It's a limitation. Who is that? Who is that place? Leave that place. You're not serious. In fact, go back to your hostel. Also, if you handle suppository, especially Pessaries are easy now, you can easily drop them on your shelf, right? But if you handle hydrophobic fat-based suppository, in fact, you do that, it's not easy to. A lot of storage conditions. You have to get fridge, you have to put it in fridge, all those things. Am I completing? So the shelf life, to maintain the shelf life, if you don't have fridge, you cannot stop them. Three of us, suppository, especially the fatty-based ones, the one that have the hydrophobic base, that is lipophilic base. But paisley have no issue. You can go to your shop and see paisley. Three of us, normal room temperature is okay for paisley. But that one, you need fridge. You need fridge to put it in fridge. Your anosol suppository, your bisacoli suppository, they need to be stored. You keep them at the normal temperature, soon they will start to melt. They will melt, three of us. So you see that to maintain the shelf life, stringent conditions are applied, which is also indicator. What if the place don't have constant supply of what? Electricity. Power, what do you do? So now the GI states. Another problem, another limitation is that the state of the GI affect the absorption of what? Suppository. How the states of the GI, how the GI is at that point in time affects what? What if there's poop waiting for defecation? It will affect the what? Look at her face. As if she doesn't poop. As if she doesn't poop. Alright, so that's the all we take on the what? Advantages and what? Of what? Suppositories. Okay, so let's look at we apply different types of suppository and talk about and discuss their what? Characteristics, okay? Different types of suppository. Dosage forms you find in what? Suppository. Different dosage forms that exist as what? Suppository, okay? Then, everyone told you that suppository is a general term. We have many of them, about 5 or so. So, we look at them and talk about one or two features they have. Take these features seriously. Take these features seriously. Study them, chew them, swallow them. Now, remember we talked about, we have rectal suppositories, we have vaginal suppositories, the one you call what? Pessary. We have urethral suppository of Bugis, right? We have nasal suppository or nasal Bugis or Buginaria. We have ear cones or urinaria. So these are, so 5 of them are urinaria. Now, let's look at this. Rectal suppositories. Rectal suppositories, they have torpedo shape. Torpedo. Who have seen most of these missiles? Who have seen missiles? Huh? You don't know what missiles are? Now? That the shape something like this. Right? Right?
Yes.
This is torpedo shape, okay? Okay? So we say that the suppository they have what? Rectal suppository they have what? Torpedo what? Shape. Torpedo what? Shape. The adult one weighs about what? 2 adult. Milligram per gram. Gram. This is gram. Even though some write gram as this, some as this. It's not milligram, it's gram. 2 what? Gram. Why the what? The children weigh about what? 1 gram. Know this point too. Know this point. So children about 1 gram, adults about what? 2 grams. Then vaginal suppositories or what? Pessary. Remember I told you that this one This one, they are compressed what? Tablet, remember? They are compressed what? Tablets. Or you call them inserts, okay? Now, what happened here is that they have what? Oviform shape. Or globe. Some also that have conical shape. There are some inserts that are conical in shape. I don't know if you've seen such before. There are some inserts that have tablet. I'm able to get some here. I think I have some vaginal insert in our place. I forgot to bring them. I think I have some. Is that what? I should get it.
Yes.
You want to see them?
Yes.
You want to see?
Yes.
You really want to see? She's laughing. Okay, let me go and get.
Yes.
Let me. I think I have. Let me go and get one I have. Look at this one. This one has normal suppository shape anyway. Look at this one. Look at this one. It's a compressed tablet. Even though it has, it's a vagina. Even though it has this shape. With this now, you can apply with this. This is supposed to expire. It has even expired, sir. So, all you need to do is just draw this thing back. I should do what? I should use teeth. Now look at it. If you draw this thing back now, you open it and put it, okay? Then you now position yourself well and press it to enter the vagina. Remove it again. Okay, you mean removing this or this one? This one? No. It will. What will happen to it? It will melt. God bless you. God bless. That what it come in contact with the word fluid there and do what? So then now go and do its work. So that's what happened. But this is exactly what I mean by torpedo shape. This is. Let me open one second. Does anybody here have scissors? Or razor blade? Anyone? Fast. Right, so this is what you mean. Any result? Fast. Bring it. It's better we see this and see how it looks like. Look at it. Can you see it?
Yes.
Can you see it? Pass it on. Pass it on. Pass it on.
My sister, pass it on.
Why was she doing this? Huh?
I've seen it. I want to see that. I've seen it.
Is that why you're doing this? No, one is okay. Don't go another one. What is it? Okay. You can feel.
They are passing it.
It should not generate noise, please. Ask. Pass it on.
This one we pass. They don't want. Who wants to see?
All right, so let's continue. What's that? Huh? You can remove suppositories after I started. Rope. Be careful about your hand. What is it used for? What is it used for? You put it after till you remove it. It not dissolve, it not melt. Dark form. Have you seen it before? You bought it yourself. Buy it for medicine. Buy it, let's see now. No, buy it, let's see. Buy it, let's see. We let them video, okay? Let me see the one I'm talking about. Okay? Is that why your business again now? Like what? Alright, so let's continue. So now, urethral what? Suppositories. Urethral what? Suppositories. Urethral what? Suppositories. So, no noise, please. You can call this one what? Bogies, okay? They are pencil. You know when I describe urethra, right? It's tiny, right? Right? The lumen is just tiny. So this one looks like pencil, okay? Looks like pencil, just something like this. To be able to do what? Fit into the what? The shape of the what? Urethra. So this one, they are like what? They have pencil shape. They are intended for male. For males. Remember I told you that male urethra is longer than that of what? Female what? Not just longer, it's longer and what?
Wider.
Now, so because of that now, for male, the urethral suppository for male weighs around 4 grams. And in length is around what?
100
to 150 millimeter long. For female is what? 2 grams. And around what?
60 to 75 millimeters.
Well, in terms of the weight though, that one is what I wouldn't say for sure. But in terms of length, it's longer, okay? Sorry about that, it's longer. For male, 10 to 150 millimeter long. Weight is 4 what? Grams. For female, 2 grams. And length is what? 60 to what? 5 millimeters. No distance, okay? No distance, so. Then for nasal suppositories. For nasal suppositories or nasal gouges or vaginaria, they are meant for where? Nasal what? Cavity. To be introduced where? The nasal what? Cavity. To be introduced into where? The nasal what? Cavity. They are prepared by what? With what? Glycerol-gelatin what? Base. What I say about glycerol-gelatin base? Those that came late will not know this one. They are hydrophilic, true of us. Now, do you know, can someone tell me, let me know those that think, can someone tell me why we use glycerol-gelatin base for nasal suppositories? Huh? Who will try? Because what happened? So do what? So that what will happen? Dissolve where? Is there any fluid there?
There is plastic.
Where?
There's no food. There is. There's food.
There's food in the nose.
But not all the time. But not all the
Time.
So the weight is around 1 gram and length is what? 9 to 10 cm. 9 to 10 cm. So what of urinaria, ear cones? They are meant for where? Into the ear. They are rarely what? Used. The base here is what? Theobroma oil. The base here is what? Inside your ear, is it oily or watery? So the base here is what? Theobroma oil. Okay. So I want us to look at therapeutic uses of what? So after that, we end this class. Remember, we have an event today. So let's look at what? Therapeutic what? As you can see in the picture, you see different shapes. Can you see it? Yes. Can you see different shapes? We have round, oval, long oval, teardrop, bullet, tampon, many, they are in different shapes. So therapeutic uses of what? Suppositories. You should be in a class. Just no. It will happen soon. Can you focus?
Yes.
So therapeutic uses of what? Suppository. I have mentioned this here. From the beginning of this class till now, I have mentioned almost up to 5 of them. But though the smart ones must have put it down. So I say that we have therapeutic uses. They can be used for what? Systemic or what? Local effect. Hope you remember what I told you about systemic effect and local effect. When a drug has rate of drug what? Absorption. 3 things. The action depends on what? The nature of the drug, concentration of the drug, and rate of what? absorption of the word. So rectal suppositories are meant for treatment of what? Constipation. Example of drug for that. Bisacodine, right?
Yes.
Bisacodine, right? You can have it as suppository. You can also have it as what? Tablet. The generic name is what? Bisacodine. But the brand name is what? The most popular one is what? Ducolax. So it can be used to treat what? To treat what? Constipation. You can also use it to treat hemorrhoids. Remember? Yes, you can use it to treat what? Hemorrhoids. We have the anosol, right? Remember? Good. These ones are for local action. Hope you know. Then for systemic action, they use for what? As analgesic. Remember when we talk about diclofenac? Remember? Suppository. Remember? Then can also be used as what? Antispasmodics, sedatives, and tranquilizers. Sedative and there are. For mentally what? You can insert it and they will go and sleep. True of us. Remember what we said about advantages of what? Suppository. Remember that. Remember. Good. Remember that, right? Yes. So sedative and tranquilizers. So these are the therapeutic uses of this. Remember? So we'll stop here for today. Unless good, there's location. In our next class, we'll start from factors affecting drug absorption from rectal suppository. There are many factors. Some has to do with the drug itself. Some has to do with the physiology, the body of the what? Patient. We will dissect them in our next class. So, location, how do you insert suppository? It should not be too high. Can you see the picture? It should not be too high. It should not be too low. If it's too low, what will happen? It will fall off, right? It should be where? In the what? Just at the middle of the rectum, okay? So this is how to insert what? So it's self what? Explanatory. I don't know if you have any question. Ask if you have. Ask fast.
Liquid paraffin can be used to treat constipation.
Yes.
Can you classify it under?
No. You drink it. Hope you know you drink it.
Yes.
You drink liquid paraffin. Okay? It enters through. It's not. You cannot. It enters through the mouth. Enter the stomach. It does its work. It enters inside from the mouth. It's oral. It's oral. It's oral preparation. It's not for external use. Okay. So
This vaginal suppository does also have the fellowship. Also see that it's
yes, you know. As I said, we have the one that is formed. We have the one that I informed tablet. This one they put it in this form. It's not a crime.
Okay, but if asked for example,
Any question? And if you watch, they come here and say, if you go through the leaflets, the touch is right. Is he oily? Is he oily? So can we call it a compressed tablet or a mold or molded suppository? Sorry. Can we call it compressed tablet when it's oily? Is it compressed tablet? Is it compressed tablet? Is it compact? I think it always started melt itself, right? They chose to do it the other way. Okay? But most of the ones you see insert are in tablet form. They choose to have this one in this form. Huh? You say what? You didn't touch it. You didn't want to touch it now. Alright, thank you very much for your attention. See you tomorrow. God bless you.